All right, we are just about all here this morning. So on behalf of Commissioner Dr. Mark Levine and the Vermont Department of Health, I'd like to welcome you all to today's webinar to debrief last week's peer share through the New England Prevention Technology and Transfer Center. So I was planning on doing a brief roll call, but now I see that I'm going to be able to just peek through a list to make sure that folks are attending. So I do not think that I will take the time to do that. We've got a lot of great stuff to hear about today, so I'll just look at that list.
Okay, just some technology issues. Hi, everyone. It's Beth Schrader from the Center for Health and Learning. Just wanted to let you all know that this webinar is being recorded. Eric is our tech support from the Center for Health and Learning, so if you have a tech support question, put it into the chat box for him. So today, I have set it up so you can unmute yourself. So right now, everyone is muted, but you can look at your name. If you could see your name on the webinar, or you can just unmute yourself through your phone or your computer. So everyone can do that when they're ready to talk. You can write in the chat box. You can raise your hand. Hillary will be monitoring the chat box. And Eric will be monitoring the chat box. So we'll make it go from here. We appreciate everyone's patience. And now I'm going to turn it back over to Hillary to do our welcome and updates. Hillary.
Okay, hello again. So I already did just kind of give the brief welcome ahead of schedule. Sorry, Beth. So yes, thank you all again for joining. And any updates, I have been sending a few emails this week. And I know that we've had a lot of just little webinars, and many of them have very similar names. So just to straighten out, now that we've got two of them finished or underway, we did have the New England peer share, and this is the debrief of that peer share. And just a reminder that we have another peer share, but this is just for the RPP grantees. It's our monthly peer share that we decided in our quarterly webinar to adjust due to the Memorial Day holiday from, it was supposed to be this Monday, to June 1st. And we were going to be discussing strategizing the issues we're seeing around alcohol policy and permissibility following the COVID-19 loosening of restrictions like curbside pickup and other social norming issues. So just to straighten that all out, the peer share will be on this coming Monday, 6/1, from 2 p.m. to 3 p.m. And then we did decide as well that our final webinar for this RPP program year would be on June 23rd. And that registration did go out earlier this week. So I did just want to make sure that I clarified all those dates again, just to make sure that we've got it straight. The updated training calendar is, as always, up on the grantee page on the Department of Health website as well. If you do want to find a registration or just make sure that you have the list of everything we've done this year, it is up and current there. And another update, I just wanted to make sure that folks got, I had provided in the email that I shared the 623 registration for. I had an update from Kristen Murray here with Health Surveillance at the Health Department regarding the Youth Risk Behavior Survey school supervisory union reports. They are hoping to have those reports distributed in about 3 weeks. Of course, this is dependent on how COVID-19 progresses and the needs for deployment for the health surveillance folks during this time. So they are aiming for about 3 weeks from now. And I just wanted to let you all know about that. If I hear of any substantive changes, I will be in touch with you as soon as I know. So those are the updates I have, Beth.
Great, thanks, Hillary. Just a reminder, a couple housekeeping things. The PowerPoints for today will be, and the materials that we share will be posted on the Center for Health and Learning website, as we always do. and this PowerPoint and the 2 other PowerPoints that I will be sharing with you, and we'll be able to get the 3rd one as well. So go to that website that's there, and I'll remind you at the end as well. Also, a brief evaluation will be emailed to everybody who's registered later today or tomorrow. It'll be just 5 or 6 questions, but it'll be helpful to get a feel for how things are going as far as using this medium. I know some folks have some connectivity issues, but we'll try to work around those at this time. So this is our plan for today, and it's an hour's not very long, so it's hard to make that happen and make something happen in a very short time. The first thing we're going to do is look at some of the issues that very briefly that were raised on the peer share call. Then some of your colleagues have agreed to present briefly about what they're doing around marijuana and cannabis issues. We're going to just open up for everybody to share, which is the purpose of all of this. Then we're going to share some tools and resources that were shared during the New England PTTC call, so that you have those, including that parent information kit that Esther shared from Rhode Island. And then we're just going to ask you for some of your takeaways based on the action plan that was sent. I know some of you took some notes on the takeaways that you wanted to have and ask you to share those. And then we'll just remind you about evaluation. And that's our hour, gone, boom. So I just wanted to bring up a couple of issues that were raised on the call last week that came to mind when I looked at the chat box and when I looked at the conversations that were happening. And, there were a lot of issues raised around youth. And I'm really proud to say that a lot of those issues were people from Vermont raising those issues. And I think that it really, the conversations that were raised around youth were pretty substantial and things that we've tried to address in Vermont before. The first was, that conflicting message between what they're getting at home, what they're getting in the media, and what they're getting in schools. And that really ties into the second, which is, the lack of curriculum, the lack of marketing education materials and educational materials in general. And, helping youth to work with decision makers was an area that was raised as well. And then finally, also, one of the things that was raised was that the idea of screening at whatever medical provider appointments they're going to, the fact that, what screening is being done by those providers. And that's an issue that there are several people in Vermont who are working on. And what I will try to do is I will try to make sure that the information on the Y expert that's out there is made available. I have some research data that I'm working on for another project that came across, so I will share that. The other issues were raised is our classic CBD issue. A lot of people mentioned, and this was also our colleagues from around the country, this idea of what the community knows about CBD, how prevalent it is, that it can be seen as an agricultural product, and this health consequences and the lack of knowledge on the effectiveness of CBD was, and other derivatives was mentioned. And then finally, one thing that was brought up was the impact of COVID-19 on the cannabis and marijuana issues that we are seeing. One of them was brought up was this perinatal use of marijuana during this time period, and obviously other drugs during this time period. And then also was brought up that, the fact that some communities might see, commercial marijuana as a revenue generating source, both at the local level and at the state level. So those were the issues that came up in the call that were highlighted in the chat box and other areas. So, and just to remind you all, you can unmute yourself if you have any comments or any questions. If you weren't on that call, we can bring that up as well. So were there any questions pertaining to that? Anyone?
Hi, this is Kate Nugent. Hello. I was noticing in the 802 quits data that we got recently, which I don't know if you guys get that as well, but that there's been an uptick in calls to the 802 quits line, which is great. But I did notice that I think it was like 1 or 2 from people who are pregnant. And so I just wondered, it just seems like maybe that's, I mean, I know we know that's a population that we're trying to work on in Vermont too, but could be combined with this data as well.
I didn't see that data, Kate, but I do get it. I haven't had a chance to look at it, but thank you for bringing that up. Okay, any other comments or questions about what was raised at the call last week? Okay. Okay, so now we're going to go into the individual comments that people volunteered. Thank you, everyone. Or I contacted them asking them to share their information that they had. I'm going to now bring up Jessica Bickford's presentation from Healthy Lamoille Valley. And let's see, we'll start that. The slideshow. And Jess, if you could unmute yourself. Perfect, thank you.
Good morning. I'm going to be kind of brief because this is our week for National Coalition Academy, and so I've got to jump on that for 11:30. So thank you for letting me go first, Beth. So our marijuana strategies, as all of you did, we set these probably about a year ago with the anticipation that there was probably going to be a commercialization bill that would potentially pass in the legislature, and we know that that's on hold. So we've been kind of changing up strategies a little bit as we go to meet the climate, which I'm assuming that everybody has. So go ahead and the next slide, Beth.
Okay, sorry, it's a little slow like me today.
We all have internet challenges. So we really kind of looked at who were our main groups of stakeholders that could motivate with us, like motivate the community as well as be allies in this work. So the first group was our youth. So we really have done some work around educating and equipping them. In February, we were able to bring 5 students with us down to the CADCA's National Forum outside of DC, and we really encouraged them to find the marijuana workshops for youth. And they were super empowered by that. They learned a ton, and they were really shocked to learn that Vermont was, depending on the age group, was #1 or #2 for use. There's a really great slide that I'll send out to Beth after. I should have included it in this, but it really ranks the states for use, and Vermont's right up there for the top. So that was super impactful and provided them with talking points and data, which was super important. Once they returned, they did a presentation for our coalition on what they had learned, which again, anytime you can get youth speaking, it's more impactful because they're seeing it in their schools. They set up a meeting with local legislators, and unfortunately, just due to the timing, we only got one, but we got buy-in for potential future meetings from a bunch of the other ones. And our legislators were really like thinking that this is legalization and commercialization is a good thing for youth. And so they were actually able to provide facts and data and doing some education work that they as youth don't feel like commercialization was a positive thing. So that was super good. One of them wrote a youth perspective article that made it into our local paper. And then they really want to set up a youth forum, not just for Lamoille youth, but statewide. So right now, that's kind of, those conversations have kind of been put on hold. And then another piece that we're doing, just kind of due to these changing times, is our Live Your Why campaign, which is really focusing on the protective factors. It's not just marijuana. but realizing that when you build protective factors, use goes down. And so that's where the readiness is in our community right now. And then the other real key piece to educating and equipping our youth was having a dedicated staff member. This idea really came up about a year ago, and we've been working to kind of build the funding components for that. So Ashley Hill's on the line with me today, and she'll be able to stay for the whole meeting. But we hired her the beginning of March, so most of her work has been virtual. So we can switch slides, Beth?
Yes.
So, oops, I think we jumped one.
Sorry. See, we were too slow and
yep.
Now it's too fast.
So the next piece is, again, kind of looking at who those key stakeholders are, and youth are so important that we wanted to bring them in first. The other piece was that we had Brad Roberts come, and he actually did 3 presentations. My next slide will kind of tie into this as well. But one of his presentations was specifically for key community partners, where they could just be open and honest. We didn't have youth in the room. They could really ask and assess the impacts of what's happening out in Colorado. Brad Roberts is an ER doc in Pueblo, Colorado, and Pueblo really wanted to dub itself as the Napa Valley of the cannabis industry. And so they are actually seeing a lot of really negative impacts of marijuana on a daily basis. So each shift he sees that. So the link to his slides is down at the bottom. We did have one of his presentations recorded. However, with COVID, our local Access TV has cut way down on staff. So that's just kind of in the queue to get edited. When we did surveys of those who attended, and they thought the facts were presented that were powerful. They wished every school could see the presentation because it was facts and actually what was happening versus just data. So that was super impactful. And just, the key stakeholders didn't realize that marijuana that we were such high use. So, so just giving that data and that information out to people is super powerful. So we had law enforcement, we had school partners, we had medical community, we had people from restorative justice there. So it was really a good cross-sector representation in the room. So, and each of those people now have more information about why marijuana is not necessarily a good thing for our communities. So the next piece of this, so Beth, you can go on to that next one now, is really kind of educating the community. That was a morning one. We also had Brad speak at 2 evenings. And so the evenings, we really invited community members, but also youth to come with their parents. So often it's parents, just telling their kids that it's bad, but for the youth to actually hear, from an expert, and then to be able to have those conversations on the car ride home. So out of the 69, I think we had about 12 youth in attendance. And one of those nights was on Stowe made it to the hockey championships, and we still had youth and their parents come. So that was super cool. And then there's a couple quotes there. So I know time is short. A couple of other things that we've kind of done on a community level is really get the resources out in the community. There's a printable on the Let's Talk Cannabis site, a 2-page info sheet that we've put in bags with Parent Up materials, prescription drug. We basically created a bag of resources for each of our key community partners. We did a survey, asked them how many of each resource, and then so it's responsive and individual to the organization. So those actually are all ready to go, but are on hold going out just because a lot of the offices are closed. We've also been using social media to share the Let's Talk Cannabis and Parent Up, as all of you have been. And right now we have a Lamoille North, one of our schools, contacted us and said, we want to run a parent support group. Will you help us? And so it's a 7-week parent support group. Ashley and I kind of co-facilitate it. And one of the topics that parents really wanted to hear about was substance misuse and the risk and protective factors. So this week, actually, Michelle Salvador, as our prevention consultant, was able to be on that call. And it was really I jumped on for a few minutes, and the conversations were really fascinating around, parents just really not even realizing hey, I should be talking to other parents about this, and so just things that we in prevention think are just such common sense were new information of maybe I should go talk to my children's friends' parents and let them know that I'm not okay with use and find out where they are on this. So so that's, so it seems very basic, but it's definitely something that we need to continue to talk about. So, and then finally, this kind of the underpinning is, and this is the last slide, Beth, is the supporting policy. Many of you are familiar with the primer. We're actually in the process of revising the primer to be a much more user-friendly workbook that anybody could kind of pick up and say, what do we hope and dream for our community? And then where do we see substances in our community, and what are the impacts? So it's kind of walking people through that process. And that Allison's doing a lot of work on that, and you can just pull out one piece, or you can use the whole component. So so she is continuing to educate town leaders, share updates with them. And then another key to this has actually been to, making sure that we have, she's part-time, making sure that we have that funding to continue to have a staff member devoted to policy, to build that relationship and that trust with the towns, so that they are seeing us as experts in this ever-changing landscape. So that's really all that I have, and I know I probably have run out of my time, Beth. So
no, that's okay, Jess. We appreciate it. So I'll ask people, if you want to ask Jess a question, you can unmute yourself and go ahead and ask that question, or put it in the chat room, or put it in the question box. So do folks have questions for Jess?
Cindy Hayford says, amazing work, Jessica. And I agree.
Thanks, Cindy.
Okay. Anyone else? All right. Thanks, Jess. We really appreciate you spending the time to put this together. And I really appreciate the fact that you and Ashley are willing to share with us. We really appreciate that. So I am going to try to click over. I'm trying to, using multiple controls here to get back to where we are. Our next presenter who's agreed to present is Cheryl Chandler. So Cheryl is from St. Johnsbury, and she's the St. Johnsbury RPP coordinator. So Cheryl, if you'll unmute yourself and go ahead and get started.
Okay, good morning, everyone. I wanted to talk today about 3 examples of policy work that has been done here in St. Johnsbury and also in the Wells River area. Tennyson Marceau was unable to join us today. He's actually doing a youth mental health first aid training of the trainers, and he's tied up for 3 days. Otherwise, he would have joined us. And I really have to credit him for a lot of the work that's been done in the area of policy. We had our Regional Prevention Partnership grant aligned with our tobacco grant back in 2017. And it's been a great project because a lot of the policy work that he's doing around tobacco also enables him to address alcohol and marijuana. In this particular RPP year, I wanted to highlight 3 things that we've been working on. And one is working with the OBX group of students from Danville, the Danville School, and their high school students. They have actually been successful in passing a substance-free policy for the Danville Town Field. That happened in June of 2019. And since that time, they were very fired up once that got approved. And Tennyson has done work with them in learning how to present to town government, and also educated them on policy work and how policies are written. And together with their advisors at the school, they were able to pass that policy in June. So because they were so fired up and got a lot of press coverage, and the town government was very receptive to what they had to say, they decided that they wanted to address the Joe's Pond Town Beach in West Danville. And so they did that in January of 2020. They worked together with the Joe's Pond Association, a group of individuals who are working for the betterment of the Joe's Pond Beach in West Danville. So in partnering with them, they also presented to the town government together with the Joe's Pond Association, asking for signage that would indicate that there's no smoking or vaping or use of marijuana or alcohol on the town beach. There was an alcohol policy in place. However, there was very little signage around that and very little publicity. So people really didn't either weren't aware of that or just did it anyway. So that was passed in January of 2020. And this past weekend, Tennyson went out with the students and the advisors, and they posted all the signage in the Joe's Pond Beach area. The maintenance of the signs will be done by the students, and that was something that was discussed with the town because they wanted to make sure that the Joe's Pond Association wasn't responsible for doing that. The other policy work that has been done is with the United Community Church here in St. Johnsbury. They own several properties that they rent, and they contacted us because they wanted to update their policies around marijuana, smoking, and vaping. What they decided was in their policy, they wanted to include that there was no smoking, vaping, or cultivation of marijuana on property. And the way that they enforce it is the first time that that the policy is not followed, the tenant is given a verbal warning. The second time they're given a written warning. And then the third time they're in default of their lease agreement and can be evicted. They also went to a monthly lease agreement. And around the time that COVID-19 hit, Tennyson was going to go and present to the tenants because they thought that that would be more impactful if someone from prevention services presented on the new policy. But unfortunately, he has not been able to do that yet. The third example that I wanted to give was in Wells River, we have a community coalition called 302 Cares. And back in the summer of 2019, we met with the village trustees. There are 3 Wells River village trustees, and one of whom is on our 302 Cares coalition, and talked with them about some of the different options that they would have related to marijuana sales should retail sale of marijuana be passed. And at that time, the village trustees were pretty divided. I would say that they were really on the fence about whether or not they really wanted retail marijuana sales, because they also were able to see that it could generate some income for the town. I don't know how many of you are familiar with Wells River, but the main street in Wells River is very depressed. There are very many empty storefronts. And so that I think that they were thinking of the possibility of welcoming a business because it would at least fill one of the storefronts and generate some income. So at that time, we decided that they were really not decided. So we needed to go back at some point in the future. Fast forward to 2020. And in January, there was an application put in for a head shop on Main Street in Wells River. This came to the attention of several coalition members, and they contacted Tennyson and myself, and were very concerned about this because it was going to be in a building that had a storefront, but also had tenants living in the upper floors. So there was a hearing that was held, and the hearing was in February, and it went before the Newberry Zoning Board, because Newberry is actually in charge of the zoning for Wells River. So they approved the application for the head shop. It was very quick. A couple of our coalition members went, a few people voiced concerns, but there were no zoning regulations that would prohibit something like that for going into place. Well, since the application was approved, several coalition members were working behind the scenes, talking with the owners of the building, voicing their concerns, talking to other community members, and that prompted the building owner to contact some of the key stakeholders in the community about the head shop, and they ultimately decided that they would not rent to the person who put the application in because it would be detrimental to the community. So this is an example of how a coalition can affect change, and also I feel that that they're ready at this point to discuss the marijuana sales, should that come to be. And we've done a lot of work on talking about and finding out about zoning laws, building a relationship with the zoning administrator of Newberry, and we plan to work also on the village trustees, although they do not have the ultimate decision when it comes to zoning. They do have influence. So that's what I have to say today.
Thank you, Cheryl, very much. Are there any questions for Cheryl at this time? You can write them in the chat box, or you can unmute yourself and ask questions. So, Cheryl, have youth been involved at all in the Wells River head shop activities? I mean, have you engaged youth in working on that?
Actually, that's one of our difficulties in Wells River, is engaging youth in that. Actually engaging youth in the coalition. We do have school involvement, and we have had a Getting to Why member who has helped with a presentation, a community forum that we have done. But as far as regular members in our coalition, that's been really hard to do, and even more so now. We talked with our representative from the school, and she indicated to us that a lot of students in that area are actually working right now because parents have also lost jobs. So they're helping to support their families, a lot of them, and are overwhelmed with school at this point.
Wow. Okay. Thank you. Anyone else have questions for Cheryl?
This is Melanie. Cheryl, I just wanted to ask if you have been in, I don't know the geographic area up there, but I know that some of the work that Ashleen Buchanan is doing in prevention at Little Rivers Healthcare might be, she might have connections with Wells River schools, or it might just be Oxbow, but have you been in touch with Ashleen at all?
So I know her, and we actually have two staff members from Little Rivers on our coalition, so they're pretty connected. And I'm also connected with the school counselor who is contracted by Blue Mountain Union School from Little Rivers.
Okay, well, I just know through our Prevention Network grant, they're trying to do more youth outreach and youth engagement, so they could be a future connection. Ashleen could be a future connection for youth involvement if you're looking.
Thank you.
Great. Thank you, Cheryl. I'm going to now invite Melanie, All right, and Melanie, you actually have, there you go. So we can now see your slides. You have control. You are a presenter. And you need to unmute yourself.
Thank you. There it is. I was talking to myself.
So everyone who does, I'm sure everyone knows Melanie, but Melanie works for Mount Scottney Prevention Partnership, and she also is the director of the Windsor RPP and also the Regional Prevention Grant as well. So Melanie wears lots of hats. So we appreciate Melanie taking the time to put this together and sharing with us some of the strategies and activities that are happening in her region. Thanks, Melanie.
Yeah, no problem. This is actually very brief, and it's not as thorough as my colleagues that went before me, but it's just reflective of one activity related to cannabis policy, where we're just trying to go through a little bit of a backdoor angle or interest area, because the whole public health angle around cannabis, commercial marijuana, isn't getting as much attention as I think all of us would like. So basically what we started to do was, oh, let's see, how do I tried to advance my slide and all it's doing is popping up.
Right, just hit the arrow bar to the right and see if that helps.
Oh, there we go. Okay. So one of the things we notice is that the current Senate and House commercial marijuana bills don't have any language regarding commercial cannabis production and impacts on the environment, but the impacts are huge on the environment related to deforestation, water needs, and specifically electricity, and impacts to the carbon footprint and the power grid. I asked at a legislative breakfast in February if any of the folks involved in that discussion had heard anything about energy, and they said no, absolutely not. From doing a little bit of research, Vermont is super big in solar power, and the solar power doesn't, I think I read recently that for a facility, an indoor grow facility would have to have a solar field 16 times bigger than the facility itself in order to generate enough electricity to power the grow. And the industry really is focused on as quick and fast grow as possible. So they're not really looking to use LED lights or energy efficient measures to grow. It takes longer and they can't produce as much. The current energy demands that other states are showing would absolutely conflict with our Vermont energy goals. And I don't even know. We have a lot of current hemp farms growing, and I don't know that there's any quantification of energy used by those farms. That might be something to look into further. So I just put in a couple of links here. The Mills, Evan Mills did a study that's most cited. I just wanted to share that with you. And it basically gave some statistics around how much energy indoor grow takes. I put also, Beth, did I send you the press release? Did that go out?
No, you didn't. No.
I didn't. Okay, well, I'll make sure everyone after this call gets that. I can also perhaps open it and share it. But so these are the two resources that we use to create a press release around this issue. We wanted to bring public attention that the cannabis bill it does not mention energy whatsoever. So then there's a resource here for connecting to Vermont energy goals. And then our communication strategy was that we drafted a press release for the newspaper through our Green Peak Alliance, which is our RPP region. It's the combined Springfield and White River Junction RPP regions. And we also asked our regional planning partner to send it out to the committee chairs, the energy committee chairs at different towns, and also are sending it to the decision makers, our representatives in our areas, to say, hey, this is something that we need to look at. I'm acknowledging that this is not an attempt to stop the commercial law, but anything we can do to slow it down or bring another perspective might make a difference. But also, if we're informing smart policy. In states that have tried to address energy, they're pushing off costs. So in addition to taxation and all of that, they're also charging the industry for how much electricity they're using and how much energy they're using to combat those costs. So, you know, there is language that exists to put that out, you know, for suggestions. But basically, the purpose of this is just to highlight this issue. Most, and this is total anecdotal, but a lot of the folks who tend to end up on energy committees tend to also be in favor of legalization and commercial marijuana. And once you point out the energy piece, they're like, oh, wait a minute, I didn't know that. And so because the Regional Planning Commission sent this out to energy committees, I have a committee up in the Royalton area who's asking me to come speak on a radio show that they have called The Green Sign. It's an energy radio show, and I basically am not an expert on this issue, but I'm trying to find, I actually reached out to Evan Mills, who gave me a couple names in Massachusetts of folks in the energy sector who are concerned about this issue. And they said that we should absolutely be concerned about this. I also have a Google Earth video that shows the deforestation in California as a result of their commercial endeavors. So I plan on making sure that the folks, you know, whoever follows up with me and is interested has access to all of these links to do some of the research and make the connections. So I think that's really all that's all I have.
Okay, well, let's open it up to questions for Melanie. If somebody could either type in the chat box or unmute yourself, I'll ask Melanie some questions.
And we do have a comment from Mary Donnelly. I find this environmental and energy information to be interesting and valuable. Thank you.
Right. Hillary, I will, or I don't know if I should send it to Center for Health and Learning or Hillary, but right after this call, I will send an email with the press release in it and the Google, or like all the links I have on this. I'll make sure to tee up an email with all of it so it can be shared.
That's great.
Yeah, and Melanie, if you send me the presentation, I'll put it on the website so people can use that for the links as well.
Oh, perfect.
Other questions for Melanie or comments? All right, thank you, Melanie. We really appreciate it.
No problem.
Sorry, this is Ashley. Ashley,
Hi, Ash.
Melanie, sorry about that. I think my computer might need to be restarted or something is going on. But I am super interested in this conservation sort of piece. I used to be on the Montpelier City Council. I was the president of our council, and it's one of the things that I'm actually working with our youth council on a little bit, just kind of, you know, talking more about the political process. And I would love to connect and see if it's something that maybe we could put on, you know, maybe we could put together like a youth component to share with, you know, local leaders about, because I think our energy committee in Montpelier had actually sort of talked about this loosely, never anything formalized, but I think we could probably get a little bit of traction with that in the central Vermont area and in Lamoille County in particular.
All right, great. Thank you very much, Ashley, for that. And our next and final presenter is Jessie Brooks from Addison, and she is the RPP coordinator there, as well as she wears many other hats at this point. So I'm going to ask Jessie to unmute herself, and I will move your slides forwards for you, Jessie. Can everybody see Jessie's slides?
It's Melanie again. Sorry, when my screenshot being shared, I got kicked out of the webinar and it sounded like there was a question for me and then I wasn't there to answer it. So
Ashley was admiring your work and said that she could see it moving forward in central Vermont. So she was going to be in touch.
Okay, great. Yeah, I'm welcome to take emails. Sorry about that. I was like, oh no, I got left. So I'm back.
Probably with me, so I apologize.
And Melanie, we got another question from Jessie Brooks, who is queuing up to speak. And she asked, was monocrop mentioned as it relates to hemp? Because this has also been discouraged, but has been overlooked with hemp.
No, I think we need to look into it more with hemp, because it'd be interesting to reach out to the Department of Agriculture, which I've talked to them before. So that's sort of maybe next on my to-do list. I'll see if I can get some information about that.
Great, thank you.
There was a big article on, I think it was Vermont Digger this week about the number of applications for hemp farms has gone down significantly this year.
Yes, I read that one, and there's also one about Vermont hoping that the medical cannabis gets federal assistance through the CARES Act.
Oh yeah, the SAFE.
Yeah, which ties into the commercial marijuana bill. So I keep an eye on that in case that means the bill might resurface sooner than next legislative session. So I think we have to keep our eye on it.
This is Ashley jumping in on that again too. One of the things that when I was still working for the state a couple months ago that everyone was talking about, I think that there are a lot of folks that are cultivating still and know that there's no enforcement mechanism right now really with the state, which I think is a bit of, which is contributing to the lower number of growers filing for permits, because I think I saw an article that there were like 2 enforcement people in essence doing the sort of permit checking. And I think that a lot of people are kind of like, well, we're just not going to do this year and wait and see what happens if we get caught, basically.
That's interesting.
Yep. Very interesting. All right. And Hillary wrote in the chat box, ADAP is monitoring the bill right now, and if she hears any movement, she will keep you up to date. Thank you, Hillary. All right, let's move on. Jesse, if you would unmute yourself, and I will move your slides forward. So Jesse is as I said, the RPP coordinator for Addison area. She works for United Way of Addison County, and we appreciate your help today, Jesse. Thank you.
Yeah, so hello. I know that we've traditionally in the RPP grant have done these webinars, but I don't know about everybody else. I've been doing a lot of Zoom calls and a lot of e-meetings, and I'm ready to actually see people in person and be a little bit more animated with people. So I thought I would shake everybody up and wake everybody up by just saying hi to a few people that I miss seeing in person. All of you, of course, but definitely Amy Livingston and Cheryl and Kate and Sunny, hello. And I'm looking forward to hopefully seeing all of you soon. And Beth, we can move on from this lovely title. So some of the things that Addison County has been doing, and I'll explain first what we sort of started focusing on as it relates to marijuana, was to really just gauge our community knowledge and sort of the climate in our community. And what I mean by that was after legalization, it was about 6 months, and a lot of our environment started to change very quickly. So we went from having a lot of cornfields around us to almost being entirely switched over to hemp. And it just happened very quickly. And from there, we saw CBD shops pop up, lots of products, CBD products and hemp products in and around Addison County. And everything was like a snap of the finger change. And what we started to be concerned about originally was sort of that permissive use and social norms. And we really didn't know, other than what we were seeing, where our community stood. And what was really helpful was around the same time that we were talking about sort of testing where the community was at with this and what people were actually thinking, we had an opportunity present itself, which was through the driver's education class at one of the 3 high schools in our community, Mount Abraham High School. The driver's ed teacher reached out to us and asked if we would be interested in teaching the substance prevention portion of the driver's education class, which of course we were happy to do. And having never done it before, we worked really closely with the teacher, and we created some curriculum that we as a prevention team presented. What this also allowed us to do was talk with the driver's ed teacher about his concerns. Specifically locally, what he was seeing was students coming in smelling of marijuana. And in the past, what that meant was that the student was using marijuana. However, the unique situation that was occurring was that these students were claiming to be employed at the local hemp farms, and that's why they smelled like marijuana. What he was also hearing anecdotally was that students who were working at these hemp farms were also taking hemp and using it the same way that you would use marijuana in smoking it. Additionally, one of the other concerns that he had was because of the proximity of the hemp fields to the school, on a warm and breezy day, the school would smell like marijuana, like the entire school. So this was just a really good opportunity to, first and foremost, obviously go in and speak with students who were just learning to drive and talk about impaired driving, especially as it relates to marijuana, because that was a high concern for the driver's ed class, the driver's ed teacher, but to also gain some insight into the impacts of these hemp fields, these hemp businesses, and the concerns as it relates to marijuana. And you can move ahead, Beth.
Okay.
Around the same time, something we worked on over the summer, last summer, and launched in the fall was a prevention-specific coalition. Believe it or not, Addison County did not have one. We had a excuse me, whoop.
Sorry.
Got me. That's totally fine. I've gotten used to the glitches in these e-presentations. Well, there we go. Prior to this, it was primarily a treatment and recovery coalition, and prevention was sort of like, and prevention in the background. So we really felt that it was time and it was important, and we had received not only RPP funding, but we had also been awarded over the summer and early fall 2 additional federal grants that we were really in a good position to create a primary prevention coalition. And we put our heads together and we came up with PEEPS. So Partners Educating and Empowering Preventions for Success, because we love acronyms in the nonprofit world. And so in November, this was launched. And in our community, we had a good sector representation right off the bat, because we had been able to build capacity thanks to our PP. And one of the main coalition's focus that was determined by different sectors was addressing the perception of harm as it relates to marijuana and alcohol. Definitely some concerns around what people were seeing with the hemp farms, as well as with CBD products. We were hearing from schools that students were coming in with CBD lemonade, and they felt like they didn't have, they couldn't really do anything about that because it wasn't within their substance use policy. And in addition to that, we and around the same time, we had a meeting with 2 of our local state reps. And we brought this information to them around the concerns of our sectors and the perception of harm of marijuana and what the hemp farming was contributing to. And it ended up being a good and not so good conversation. A good conversation because I learned a lot, and a not so good conversation because they weren't exactly saying what I wanted them to say, which is always a problem in my eyes, right? So they basically were really for the ag industry of hemp, and were not concerned or seemingly worried about the impacts of youth. So it led me to understand that we really had some work to do still with marijuana education, and that's why I think PEEPS came at the right time and was really a good fit for our community. So that was launched in November, and we've had meetings monthly ever since. And we have had some barriers thanks to the pandemic with hosting meetings and doing the work that we intended to do, but we're still plugging along there. Beth, you can move on.
Yep, there you go.
And one of the things, backing up to February, if any of you can remember what it was like to travel and go to conferences and week-long trainings, we used to do that. And we did it back in February with 10 students from Madison County and 2 teachers from Madison County and myself. One of the students was actually our paid youth prevention coordinator, Olivia, and we actually hired another youth prevention coordinator, so it's 2 youth now working for United Way prevention team. But one of the things that came out of this was the opportunity for students and the teachers to participate in workshops and the different breakout sessions at CADCA. They got to learn about marijuana prevention, policy change, youth empowerment, and then use their voice and their expertise when they went to Capitol Hill for the day. And I know Cindy Hayford's on this call, so she'll remember that fondly, where all the students spoke really, really well that day to different Vermont state representatives to discuss their concerns about youth access to marijuana and contributing to social norms. This was such a great opportunity for the youth to really get some formal training and education around marijuana and policy change so that we can bring them back to the community to be agents of change. I think Jessica Bickford did a really good job explaining why youth are so important when it comes to this prevention work, because people actually listen to them. It's why we have 2 paid youth staff at United Way, and why we try to engage youth as much as we do, as well as get them trained up so that when we do have them go out into the public and speak or write a blog for us or whatever it may be, they're using the prevention language and they're using the data to support what they're saying. And I think for the most part, that's it from Madison County.
All right, thank you, Jessie. We have time for a question or 2 for Jess as we go forward. Questions? You can put them in the chat box if you want.
There is a comment from Kate Nugent, who is describing some findings of a presentation at the South Burlington Rotary Club meeting. A couple takeaways she said about hemp growing. One, they said the most lucrative market for hemp growers has been the smokable, in quotes, CBD for, quotes, therapeutic purposes. Second, they said that most hemp producers did not make money like they thought they would, which I think goes back to what you were saying, Beth, about there being less growing this season. Thank you, Kate.
All right, anything else for Jess? All right, thank you, Jessie. We really appreciate it. We have a few minutes just for, I know we're running over for open sharing, so if anybody wants to unmute themselves. At the same time we're doing that, I'm going to put up the resource and tool slide so everybody has that as well. So other comments, just have to unmute yourself, but please feel free to do that. Okay, you can write it in the chat box or in the questions as well if you have something as well. Hillary, are you seeing anything in the chat box?
I see a hand raised. I was just trying to find out who it was, and then I think it went away.
Oh, that's me. It's Crystal from St. Albans.
Go for it.
Hey, Crystal.
So Beth and I are actually chatting this morning about this. One of the things that we found really difficult in our work with the youth, I think as Jess or Jessie mentioned, they're kind of feeling burnt out right now with distance learning. So some of them have just had a struggle with continuing with their advocacy work. The other thing that we've really found is that a lot of our kids right now are finding themselves in situations where they have really adult concerns and worries, things like how their parents are going to pay the bills, how they're going to keep food on the table for themselves or their siblings. So we're finding ourselves shifting focus a little bit and helping them with basic needs like food security, so that they continue with the advocacy work that they've been doing. I'm not sure how other counties are faring, but we are primarily manufacturing and dairy industry in Franklin County. We have a lot of folks that are out of work or receiving, lower milk checks monthly right now because of dumping that was going on and things like that. So our kids are kind of being faced with things that they haven't been faced before. And we're really finding ourselves with kind of shifting roles and helping them out. So just something that I don't know if anyone else is kind of dealing with that as well.
All right, thank you, Crystal. Others who want to share a little or talk about maybe a key takeaway that they have today, that would be helpful. I know everybody's ready for lunch. I know I am. Anyone else want to check in? Okay, I just wanted to mention a few tools and resources from the peer share call in case you didn't get them, and these will be on the CHL website. You can go into this document and take a look at them. One was the woman from Portland was talking about her board policy, Portland, Maine. So I put the link on there for that policy she shared. Also, someone else mentioned, I think it was from Ohio, at the drugabuse.gov, there were some great publications for parents and letters to parents that you could use. And then finally, Esther from Rhode Island sent me her parent marijuana packet. I'm going to put that packet on the CHL website under resources. It's really good, I have to say. So if you would take a look at that, I would recommend it. And there's some great materials on there. And that'll all be on the CHL website. I just wanted to remind you that during the call, we also gave you that action planning document that we've been using throughout the RPP process. And in there, it has some key takeaways. So I hope that you use that document and you put your key takeaways in there and are willing to share if you would like. And again, you can do it in the chat box or in questions, or we can go from there. And finally, just a reminder that everything is on the CHL website and that you'll be receiving a free evaluation email to you tomorrow. So look forward to that. It'll be in SurveyMonkey. And then I just want to turn it over to Hillary to say anything else that you'd like to say, Hillary.
Sure, yeah, thank you all very much for your participation in the NEPTTC webinar. I was just really happy to see how much that our region was able to share with the region and other areas of the country. I think you all gave a lot of good food for thought for other regions, and so that was really awesome. And going further in depth today has been super beneficial to hear about the importance of youth voice and finding other doors to substance use prevention and just really being there to support communities during this time. You're all doing wonderful work, so thank you for sharing it. Speaking of which, Melanie did send along her resources too, so we'll make sure to get those up on the website as well. Thank you all for your time today. I don't have anything else. How about you, Beth?
No, I just wanted to thank Eric Jones from CHL. He's behind the scenes keeping us honest, and I really appreciated his help today. So you always know the man behind the curtain. That's, in this case, it's Eric. So I wanted to thank him. And just, again, offer, if you have any resources, email them to me, beth@healthandlearning.org, and I can also put those on the website under this webinar as well. So we'll see you all on June 23rd from 10 to 12 noon for our final RPP training of the year. And I'll be sending you information for that webinar, some homework, and some behind the scenes stuff that needs to get done. And I promise we will take a few minutes during that 2 hours and celebrate all of us and our relationships and the work that we've done over the last couple of years. So look forward to something in the email from me on that as well. So have a safe day and be healthy, and we will talk to you all very soon. We're going to end the recording now, and thank you everyone for being here. Eric, can you stop the recording?